I want to get back to something you said
Yeah.
a minute or two ago. And it seems to me that world aid leaders now are a little bit more defensive today than they had to be 2 years ago, in the sense of people questioning whether the epidemic, if it's stabilized, the revision of the UN AIDS estimates going down, so many billions of dollars being funneled into this. Is that an issue for you?
This is one of the biggest issues that we would like to address in this conference. You know, there are some words over there that say, you know, too much money is being spent on AIDS. And this is weakening the healthcare systems. So let's think about that. Is this true? Are you telling me that before the AIDS epidemic started to get funds, the healthcare systems in Africa, for instance, were marvelous? Were like the Mount Sinai Medical Center in New York? Or are you telling me that due to the AIDS epidemic, we don't have enough TB clinics in Africa? We don't have STD clinics? Or does it work exactly the other way around? If you look at the report that was released by Médecins Sans Frontières, Doctors Without Borders, which, as you know, is an NGO completely independent from IAS and from pharmaceutical industry, etc., etc., what they say is that they have seen that in those sites where they started HIV clinics, the overall level of clinical care for patients has improved. Because when a patient comes with HIV and he is coughing, he will get attention for his potential TB or pneumonia or whatever he has got. It's also linked to STD, it's also linked to reproductive health. And you will see in our program during the week that we have specific sessions devoted to how to better integrate healthcare system with HIV programs, not by shutting down the HIV programs, not by shutting down the financing of the HIV programs, but trying to leveling up the healthcare systems.
Okay, that's the final word. Thank you so much, Dr. Pedro Cahn.
Thank you.
Okay.